You have to be an active participant when it comes to your overall health and wellness, whether you want to lose weight, get a little bit faster, get a little bit stronger, just have a healthier lifestyle. You have to be an active participant. There is no magic pill or powder or potion that is going to do it for you. And if they do, it is going to be very short term and more than likely come with some risks. Yesterday morning, I had an acquaintance who actually decided to use Ozempic about 4 or 6 weeks ago and was rushed to the ER with severe stomach pain and cramping yesterday. So I'm thinking of this person, I'm praying for them and hoping that it is nothing serious. But drugs like semaglutides are not the answer, folks. They're just not. If you need them for obesity and type 2 diabetes, talk to your doctor, ask a lot of questions. But if you're doing it or if you're on them for vanity, I just absolutely do not recommend it. It is not worth the short-term results and definitely the risks that come with it. So anytime you diet, let's have a little lesson on muscle. Muscle is extremely valuable real estate. We work really hard to acquire muscle. Muscle makes us age better. It supports our skeletal structure. It helps our metabolism. There's just so many benefits to having muscle, and muscle necessarily is not being a bodybuilder, okay? So when I say muscle, you don't have to be ripped. You don't have to have six-pack abs. You have to understand that muscle is part of our overall structure. So when you look at the digestive system, when you look at our heart, when you look at our diaphragm, there's a lot of muscles inside of our bodies that are important, and that muscle is so extremely crucial. So when you diet, you're bound to lose some muscle. But when it comes to weight loss drugs like Ozempic and Wagovy, the amount of muscle that you lose is more than you would on a typical diet. So that is not good. Muscle is not only what you see on the outside, but definitely those muscles on the inside as well. So one of the symptoms of these semaglutides is gastroparesis, okay? And that is where the muscles and the nerves in the stomach weaken. That is not good, folks. And so a lot of people, when they're experiencing these stomach pain, digestive issues, there's things happening on the inside that are not good and maybe not even repairable. So muscle is crucial. It's valuable real estate. That's why strength and conditioning and toning is so important when you're going through any type of a weight loss experience or journey. Make sure that you are doing some strength training along with it. It could be push-ups, could be air squats. You don't need weights to necessarily do that, but it's definitely crucial and definitely important. And then any of the drugs out there that are going to decrease your muscle faster than you would with a normal diet where you're actually putting in an effort to lose weight and become fitter and healthier, they're just not good. So please ask questions, know the risks, know how long you're going to be on these diet drugs. They're extremely expensive. If it's a year, it could mean $12,000, $15,000 for you or your insurance company, which is just not sustainable financially for you or your insurance company over a long-term period. And then once you get off of the semaglutide, what does that look like for you? Most people are gaining the weight back. So when you're losing quite a bit of weight in muscle is harder to gain back than fat. The weight that you're gaining back is almost all fat. And so you're actually losing fat and muscle and then gaining the weight back, but it's all in fat, which is making you bigger and fluffier and probably not any healthier. So there's that.